Welcome to Ace My Exams Learning. Let us get started with today's learning.
Life Orientation Grade 12. Question: define a lifestyle disease and indicate why TB is considered to be such a disease. A lifestyle disease is a condition that is usually associated with poor diet, smoking, substance abuse, and lack of exercise. These habits gradually weaken the body and increase vulnerability to illnesses, as the immune system and overall health decline over time. For example, a person who eats an unhealthy diet and does not exercise may develop conditions such as heart disease or diabetes. This definition highlights that lifestyle diseases are largely preventable if healthier choices are made consistently. TB is considered a lifestyle disease because of the following reasons. Firstly, TB is seen as a lifestyle disease because it primarily affects low-income people. Individuals in this group often face limited access to nutritious food, healthcare services, and education about disease prevention. Their socioeconomic status indirectly contributes to a higher risk of contracting TB, as poor living conditions and insufficient resources weaken the body's ability to fight infection. The affected populations often follow a poor diet. Malnutrition weakens the immune system, making it harder for the body to resist TB bacteria. Poor dietary habits, which are influenced by economic constraints and lifestyle choices, increase susceptibility to infection. Additionally, TB spreads most easily in crowded areas with poor ventilation and unhygienic conditions, which are common in low-income communities. Overcrowding allows TB bacteria to spread more easily from person to person, while lack of fresh air and inadequate sanitation further facilitate transmission. These living conditions are linked to human behavior and socioeconomic lifestyle factors, demonstrating why TB is lifestyle-related. Furthermore, certain behaviors, such as smoking, substance abuse, or neglecting personal and environmental hygiene, increase vulnerability to TB. These unhealthy habits and/or behaviors weaken lung function or compromise immunity, making infection more likely. Lifestyle choices, therefore, play a critical role in both contracting TB and in its progression. Lastly, low-income populations often have limited access to medical care and delayed treatment, which worsens TB outcomes. The lack of preventive behavior, regular screening, or early intervention allows TB to spread more rapidly within communities. These lifestyle-related barriers demonstrate the strong link between human behavior, environment, and TB infection. Question: discuss ways in which poverty may be a contributory factor to the increase in TB infections. Tuberculosis, TB, is a contagious disease that is heavily influenced by socioeconomic and environmental factors. Poverty significantly contributes to the spread and severity of TB in the following ways. Firstly, tuberculosis, emanates from the way in which people live and interact with the environment. One of the most significant ways poverty contributes to TB is through overcrowded homes. The poorer the community, the more overcrowded homes become, and members are more likely to infect one another with TB. Overcrowding facilitates the airborne transmission of TB bacteria because people live in close proximity, often in poorly ventilated spaces. Therefore, overcrowding not only increases infection risk, but also highlights how environmental factors combined with poverty make TB more prevalent in disadvantaged communities. In addition, poor communities often face a lack of, or there are poor basic health services, which all contribute to the spread of TB and its impact upon the community. Limited access to clinics and trained medical personnel prevents early diagnosis and treatment, allowing infections to persist and spread. Even when some health services exist, other barriers such as transportation, cost, and social stigma can prevent individuals from seeking care. This demonstrates that healthcare access is a crucial link between poverty and TB prevalence. Furthermore, with no health services to diagnose or treat patients, there is a longer delay between disease and cure, perpetuating the spread of TB. Delays occur because individuals may not afford to travel to clinics or may prioritize daily survival needs over medical attention. Consequently, TB infections can remain untreated for long periods, increasing the likelihood of transmission and more severe disease outcomes within the community. Moreover, poverty may make it difficult for people to take their TB medication as prescribed and to follow up regularly on their treatment, thus causing multi-drug dependency and extreme multi-drug resistance TB. Financial constraints, limited support systems, and lack of education about treatment protocols can lead to interrupted medication, allowing drug-resistant strains to develop. This illustrates how poverty not only contributes to infection, but also complicates treatment and disease management. In addition, poverty leads to poor nutrition and diet, which may then weaken the immune system and increase the chances of TB infection. Malnutrition reduces the body's ability to fight infections, making individuals more susceptible to TB bacteria. In low-income communities, deficiencies in protein, vitamins, and minerals further compromise immunity, creating a cycle where poor health increases vulnerability to TB. Similarly, poor communities may have lower levels of education on health issues and may not be able to recognize the symptoms early and get appropriate help. Lack of awareness delays diagnosis and treatment, allowing TB to spread further within the community. This emphasizes that poverty influences both the environment and knowledge level, which together affect how the disease is detected and managed. Additionally, poor sanitation and a lack of clean drinking water could lead to the spread of the disease. Unsanitary living conditions weaken general health and exacerbate vulnerability to infections. While TB is airborne, poor hygiene and contaminated water increase susceptibility and can contribute to other illnesses that complicate TB outcomes. Addressing sanitation alongside medical care is therefore critical in reducing TB spread. Poor communities often face a lack of or there are poor basic health services, which all contribute to the spread of TB and its impact upon the community. Limited access to clinics and trained medical personnel prevents early diagnosis and treatment, allowing infections to persist and spread. Even when some health services exist, other barriers such as transportation, cost, and social stigma can prevent individuals from seeking care. This demonstrates that healthcare access is a crucial link between poverty and TB prevalence. Finally, poor communities may not have sufficient funds to afford specialist treatment that are available in private hospitals and clinics, and hence may not get the best possible treatment. Even when public healthcare offers basic TB treatment, the lack of specialist care can result in slower recovery, higher complication rates, and increased transmission risk. This highlights how financial limitations directly affect the quality and effectiveness of TB management in impoverished areas. Tuberculosis emanates from the way in which people live and interact with the environment. Therefore, poverty directly increases TB infections by creating conditions that favor the spread and severity of the disease. Factors such as overcrowded homes, limited health services, delays in treatment, difficulties in taking medication, poor nutrition, low health education, inadequate sanitation, and lack of access to specialist care all contribute to higher infection rates.
To access more learning and exam preparation materials, go to www.acemyexams.coza. This link is also in the video description below. Thank you for watching this video. Remember to subscribe and be the first to know when we upload new videos.